Want to get to a D.C. news alert now. The D.C. Health Department investigating the district's first possible case of monkeypox. Health officials say the patient is a D.C. resident who recently traveled to Europe. Samples have been sent to the Centers for Disease Control and Prevention for further testing. The patient is currently isolating. It does not pose a risk to the public. At least one case has already been confirmed in Northern Virginia. This case not yet confirmed. They believe it is some type of pox, and they're waiting to see if indeed it is monkeypox. Concerns growing about the spread of monkeypox, though, all across the country. But how worried should we be about monkeypox? Is it time to panic? Let's bring in infectious disease expert Dr. AMESH ADALJA with Johns Hopkins to break it down for us. Good morning.
Good morning. Thanks for having me.
Yeah, absolutely. So I guess the big question is, how concerned should we be?
For the general population, I don't think they should be overly concerned. Monkeypox is something that's been known to science since the 1950s. This outbreak is unusual in that it's spreading in people who have not had contact with any of those countries in Africa where this is endemic. But what we find is that this is spreading in social and sexual networks and is largely being driven by those types of transmission events. And we have a tried and trusted vaccine that can work. We just need to deploy it appropriately to the contacts of cases, and we'll be able to stop this outbreak. It's going to take some time. We should expect to see more cases, but this is something that is containable.
So I guess when you have those kind of, I guess you could compartmentalize it a little bit. Is there a way then to get to people who may or may not be most likely to be exposed to it then, to get the message across? And for those who are not, I guess, is there concern in general terms?
So monkeypox requires close contact, often skin-to-skin contact to transmit. So it's not something that you can get casually. It's not as contagious as a respiratory virus, for example. What we need to do is make sure that people are aware that this is spreading, especially men who have sex with men. That's what it's allowed this outbreak to get somewhat out of control, was that it was spreading in a way that it hadn't before, through sexual contact. Not that it's sexually transmitted, but the close contact, skin to skin, that occurs. And it was presenting to sexually transmitted infection clinics and presenting with genital lesions versus generalized rashes, which led to misdiagnosis and then led to more people getting infected. So what we have to do is make sure that people are aware that this is here. And if you've got genital lesions that might be consistent with monkeypox, you need to let your health departments know and get testing done immediately and isolate those people. But we can control this. We had an outbreak of over 40-something people in 2003 in the Midwest, tied to the importation of African animals, and that was able to be stopped. This is more challenging because it's amongst people, but I think we have mechanisms to put in place to stop this.
Which is what I was going to ask, is unlike the early days of COVID, when we really didn't know what we were dealing with, if we already have, obviously, the vaccine out there, we kind of seems like the medical community has a much better idea what we're dealing with. So if somebody should end up believing they have it, or they have that close contact, or they do have it, it sounds like the mechanism is in place to treat it.
Right. We don't have specific treatments. A lot of it is supportive care, but the way we contain these outbreaks is to find the contacts of that individual and then vaccinate those people. We don't have to vaccinate everybody. We use what's called ring vaccination, and that stops outward transmission of the virus. And there is this tendency to look at every infectious disease through the lens of COVID-19, and you can't do that because each virus, each bacteria, each pathogen has different biological characteristics, different transmission characteristics, and different control measures. And something like monkeypox does not have pandemic potential.
Since COVID came onto the forefront of our lives 2 years ago, now it seems like any disease, any outbreak, anything that comes out there, it gets our attention perhaps more than it ever did in the past. Is that a good or a bad thing these days?
I think it's mixed. I think it's really great that the media and the general public are interested in infectious disease emergencies, because that's how we gain, we gain momentum to actually put in place systems to control these and to stop them from happening. But you also have to remember, as I said earlier, that each pathogen is different, and not everything is going to have the same level of threat as COVID-19 did. And I think it's important to get that nuance, because oftentimes people don't really realize that there's different transmission characteristics, or they may never even heard of monkeypox, for example, before now. They may not even realize that there were 2 cases in the United States last year, or that there was a big outbreak in 2003. So you have to be able to put that context there so people don't panic, so that we don't think of everything as the next COVID, but they still deserve attention and deserve resources to be brought to bear.
Sure. All right. Agree with you on that one. Thank you, Dr. ADALJA. It's always good to talk to you. Appreciate your time this morning.
Thank you.
All right. It's 9:20. Wisdom, back to you.